Since the advent of the Zika virus last year, countries have been declaring that they'll be focusing on pregnant women, and one of those countries is taking a step further. When Jamaica's Minister of Health, Dr. Christopher Tufton, reiterated the point at a recent press conference, he noted that their partners will also be monitored. Dr. Tufton also stated that the minister will be paying close attention to individuals who develop Guillain-Barré syndrome.
We will continue to make provisions for a possible increase in cases with severe diseases, and so we'll be doing a number of things. Now, as it relates to the pregnant women, we discovered the first case of Zika back in January 26. Fast forward 9 months to the cycle of pregnancy, and the reality is you will begin, I think, to discover or otherwise cases September thereabout. That's when the 9-month cycle would have expired. In the case of that other case where we tested and it was negative, we have reason to believe that there's no linkages because that person would have conceived sometime last year, and had that child 9 months after. But we believe that come September and beyond, the risk of seeing some of those cases will increase.
Dr. Tufton explains the steps the ministry will be taking going forward.
Firstly, working closely with the healthcare providers in the public and private sector. We are going to be employing or engaging 1,000 workers, temporary workers, initially for 3 months, to support the public health team in engaging an island-wide community, not just vector control, but public education and information. We have to take the message directly to people on the ground in the communities, and we're going to be working with a number of agencies, local government, Ministry of Education, because we're going to use students also, not in this 1,000, but in addition to members of parliament, other government agencies such as Heart Trust and other community-based groups as part of the carriers of that message to inform and hopefully to change and influence behavior consistent to preventing breeding of the vector, as well as treatment if symptoms are detected. Hosting island-wide education sessions working through agencies such as the Social Development Commission.
Minister Tufton says for the latter, assistance will be sought from the various neighborhood watches, the police and other community-based groups. He notes that the minister will continue to monitor pregnant women at the community level throughout their pregnancies, including providing them with educational support.
In a tangible way, we have taken a decision, and this has been supported by the charitable organization Food for the Poor, to provide nets for every pregnant woman over the next 6 months. We have secured 20,000 of those, those bed nets that you hang over and protect you from the vector, from the mosquito. We'll provide every pregnant woman, which we have about 40,000 pregnancies per year. So we have enough supplies at least for the next 6 months, administered through the health facilities throughout the country. Enhancing risk communication, public education through various media and fora, including town hall meetings in high risk and other communities. You'll see us out in the field doing more of that. And of course, we'll continue the vector control through fogging, which is an ongoing effort. Conducting heightened house-to-house surveillance in sections of the population where the infection has been notified or confirmed. And of course, we'll be working with our international partners, PAHO, WHO, CARPHA, and CDC to ensure that our actions are aligned to international standards and best practices.
Dr. Tufton reminds the public that caution needs to be exercised to protect themselves from contracting Zika.